Hi, I'm Dr. Josef Witt-Doerring, psychiatrist specializing in adverse drug reactions. And I've been wanting to do a video for a long time on a type of business that has been described as predatory and reckless by a lot of people within the drug-injured community. And those are these pill mill type companies like Hims. These are websites where you can go and fill out questionnaires, and supposedly you can get prescribed medications pretty easily, sometimes even without meeting with any providers. And I wanted to go through that process. I wanted to see if it was really as bad as people make it sound. And so I did. And today you're going to see a walkthrough of what it's like to get medications like antidepressants from Hims, and just see how easy it is. And I'm going to provide some commentary at the end of the video about what I think is wrong with this model and why I think people should be really cautious about addressing their mental health in this way. So I hope you enjoy this, and let's jump right into it. So I wanted to do a video today on just how easy it might be to get antidepressants online. So I've been actually curious about this. So I figured I'd just go ahead and give it a go. And I've been aware of these, I guess what I would call them pill mills, and I've never signed up for them, so I haven't really seen what it's like before. I'm hoping it's not as bad as I think it is. You know, I'm kind of expecting that I'll fill out a questionnaire and get a script pretty easily without much warning, but I'm going to go through the process and give it an honest review for just how potentially negligent it is. But who knows, I might be surprised. So let's check it out. Okay, so here we go. Depression meds from your sofa, anxiety meds. Feel anxious? Try Hims. Low-cost psych treatment. Treat anxiety online. That is what I'm going for. Okay. Action items. You recently started a visit for premature ejaculation. Okay, so I was looking at this before to see how easy it was to get Paxil on here for premature ejaculation. Nothing sus going on, so I'm going to just X out of that. Let's see. How can we help? See if the treatment's right for me. Ooh, emojis. Okay, so let's say stressed. Believe it or not, checking in with yourself. Okay, cool. That's nice. I live in Utah. It's my birthday. First timer. I'm in the right place, 40% of people. Kind of just like me. Okay. All right, so we're going to do a questionnaire. Let's say over the last 2 weeks, how often have you been anxious? I'm going to just say more than half the days. More than half the days. Yep. Have you been having trouble relaxing? More than half the days. So restless that it's hard to sit still? No, that's not me. Irritable and annoyed? More than half the days. More than half the days. Very difficult. So, I mean, I'm just filling this out as I imagine, most people would if they had anxiety. More than half the days. Difficulty falling asleep, let's say every day. Let's say both. Poor appetite. I'm going to say both. Feeling bad about myself more than half the time. Concentrating. Mix it up, say several days. Not at all on this one. Let's just say somewhat difficult. My results, moderate anxiety, moderate depression. Okay. These aren't a diagnosis. They can help your provider make a plan to help you feel best. A few questions about your medical history. Let's just say not at all. Not at all. Persistent or excessive worry. Just do more for anxiety. Let's just say I got it when I was a teenager. How many episodes of my life? Let's just say one. How have you been feeling for the past few weeks? Stressed. I'm just going to say stressed. Let's say none of them apply. Yes. Not sure. No. 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 Man. None apply. Let's say a few times a year. Recreational drug use. Okay, let's just say none. Most people probably lie there anyway. No. 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 Board licensed medical provider. Okay, your provider may consider a treatment like this, Lexapro. Got it. Okay, all right. So, got the starter plan. Recommended for those new to meds. Provider will find a plan that works for me. Cost of meds and adjustments. Dose adjustments. Ongoing care. Okay, $150, but for the sake of YouTube, I guess we'll do it. Only be charged if prescribed. Wow, that's quite an incentive. Just stay on the 3-month plan. Let's just say Facebook. Looks like I need to download the app now. So I'll download it to my phone. Be able to message my provider and get updates about my treatment and track my order. Cool. So I guess, is that it? I think I just need to download the app now. Well, I'm kind of curious. I wonder if I'll actually speak with someone or whether I get the medication just based on my questionnaire. So stay tuned. So it's been about an hour, but I've just been informed that my treatment was approved. So we're going to go and have a look at this message. So here we go. So this was pretty quick. Hi, Josef. I'm a licensed nurse practitioner. Glad to support you. Thank you so much for providing medical information and reaching out for help. It can be very hard to address mental health concerns, and I should be proud of myself for taking this step forward. Probably, yeah, seems like like a canned sort of copy and paste response. We're glad you're here and supported to helping you feel better. This has important stuff to help you get started. My treatment plan. Based on your medical information, I developed a treatment plan I think will be a great fit for you. Your symptoms of moderate depression and anxiety make you a great candidate for a med called Lexapro. It's taken every day and it has minimal side effects that usually subside quickly, and most patients generally start to show improvements in a few small weeks. I've prescribed you 5 of Lexapro. Before you get started, review your medication overview for safety information. Okay, so we're going to have a look at that. If you have any questions or concerns about your treatment, or if there are any important changes regarding your health, please reach out immediately so we can provide you with the right direction. Keep in mind that discontinuing medication for mental health requires guidance, so do not stop it unless directed to do so by a medical provider. On that note, it's important that your healthcare providers are aware of your current treatments. Please let your PCP know about your mental health diagnosis and your meds. And notify your pharmacy of the new meds as well. Visit the help spot to learn more about the meds. Finally, if you're experiencing suicidal thoughts, please call 988 to get to the Suicide Crisis Center or go to the nearest emergency room. We'll follow up with you in 4 weeks for a check-in to see if your symptoms are improving and hear from you regarding anything else you're noticing with your treatment based on your progress. It's not unusual that we may adjust your meds as part of your personal treatment plan. Let's get you feeling like your best self. Thank you. This whole thing could have probably been written by like an AI or a robot. Thanks. Talk to you in 4 weeks. Okay. All right. So let's see. guess this is the informed consent here, which is just kind of sent over here. And so let's go through it. Yeah, it's provided for depression and anxiety. Take the starting dose for the first 7 days or the first 4 weeks, depending on the strength of the pill. Continue your meds as prescribed. If you choose to stop the treatment, guidelines recommend a short taper off your medication between 2 and 4 weeks. That doesn't usually work. Reducing your dose in half each week until you're out of medications. Studies have shown that a taper can reduce possible discontinuation symptoms. Your healthcare provider will provide individualized guidance. Okay, this is way too fast if you're on these meds for any longer than, let's say, 3 months. Sleep, energy, and appetite may show some improvement in the first 1 to 2 weeks. It's an early sign the meds are working. Depressed mood and lack of interest may need 6 to 8 weeks to fully improve. Okay, so we got the warnings here. So we have the suicidality warning, may increase suicidal thoughts or actions within the first few months or when the dose is changed. Talk to your provider right away. That's pretty good. Don't take it with an MAOI, or if you're allergic to it, makes sense. Tell your healthcare provider if you have bipolar or suicidal thoughts. Yep, that's all pretty good. May have some drug-drug interactions. It's used off-label for generalized anxiety disorder. Patients and their caregivers should be alerted if there's anxiety, irritability, or restlessness. Watch closely for worsening suicidality. These are some serious side effects. Lexapro can cause serious side effects and should be reported if you have bleeding gums. That's the bleeding risk. Low sodium, teeth grinding, seizures, serotonin syndrome. Okay, sexual side effects. Wow, okay, this is sneak it in. Sexual side effects such as problems with orgasm or ejaculatory delay often do not diminish over time. Okay, so not exactly talking about PSSD, but I guess they're saying that often this is not something that goes away in the first few weeks. And where to find more side effect information, talk to your healthcare provider. And then there was this section here. Oh my God, the premature ejaculation stuff is up again. Okay.
So it's been about 4 days since I did the survey to get the Lexapro, and it's arrived. So let's go check it out. So it's come in this box from USPS. It is from Hims, and I think we should just check it out and have a look at what we got in here. So it comes with the Lexapro, and so I've got 5 milligrams once a day as prescribed. And then I guess essentially it's just all of the other information. There's safety information, patient handout. Who knows how many people really read that stuff. So, this is crazy. I did this survey in about 10 minutes. You just saw me doing it. That's how easy it is to get this medication. There was no counseling on the side effects or anything like that in the process. This is scary stuff.
Okay, so in conclusion, I have to say that was worse than I expected. So we managed to just get a script for Lexapro without even talking to anyone. We clicked a few buttons on a form. We were diagnosed with moderate depression and anxiety. I'd mentioned I'd never been on meds before. Someone messaged me over an app with boilerplate text that almost seemed AI written, or just, had the provider's name on the top and just, the nurse practitioner's name on the top and just boilerplate text. And they wrote me a script. This is everything that's wrong with mental health treatment today. Let's talk about what was absent from that. Any human interaction at all, any person on the other side saying, hey, Josef, could your depression or anxiety be due to something else in your life that's addressable? Hey, have you thought about other ways to treat your depression and anxiety that's not going to cause dependence or side effects or problems? Let's have a chat about that. No, there was absolutely no discussion of that at all. No face-to-face confirmation either that I understood the side effects of these medications. Essentially just sent me to like a PDF and was just like, maybe you read it, maybe you don't. There was no, hey, Josef, do you understand these side effects? Do you have any questions about suicidality or those risks at all? I mean, from my perspective, this is not true informed consent. This is not medicine. These are people who are essentially gaming the system. They're using questionnaires and checklists and kind of just are just a rubber stamp for people to get meds if they want them with, what really seems like little oversight. So, I mean, this is really, really bad. So let me know what you think in the comments below. I find this absolutely horrific, and I'll be updating you with what I see. Thanks.